Hello and welcome to The Drama. I'm Ellen Fanning. Coming up, racism, vandalism and slut-shaming, the occupational hazards that come with a career in politics. Today, Labor's record is under scrutiny. As Papua New Guinea teeters on the brink of a COVID-19 catastrophe, Australia mobilises to protect the Torres Strait Islands. And the hunt for a vaccine, another 6 million Aussies will soon be eligible for theirs, but finding someone to administer it could be a challenge. Joining me on the panel tonight, Senior Accounts Manager for communications firm Agenda C and Urban Vice President of the New South Wales Liberal Women's Council, Jackie Munro, new to the program. Thanks for coming in.
Great to be with you.
In Wollongrar, did I get that right? Farmer and Chair of the Regional New South Wales, Regional Australia Institute, Mal Peters. G'day, Mal.
G'day, Ellen. How you going?
Very good. Great. All the better for seeing you. In Melbourne, plastic surgeon Dr. Neela Janaka-Ramanan. Good to see you again. It's been a while.
Yes, hi Ellen.
And always wonderful to see Pat Turner. She's in Canberra tonight, CEO of the National Aboriginal Community Controlled Health Organisation and lead convener of the Coalition of the Peaks. G'day, Pat.
Hello, Ellen.
And you can join us on Twitter using the hashtag #TheDrum, and we are on Facebook. The government has turned the blowtorch on the Labor Party over Australia's toxic political culture amid allegations that bullying and misogyny has long been hushed up within the halls of Parliament House. In a speech last night, outgoing Liberal MP Nicole Flint savaged the opposition, alleging they were complicit in the abuse she was subjected to.
The safety of women in this place, of female staff, of female MPs and senators, should be above politics. The need to change the culture of our parties and of this place should be above politics. What I say to the Labor Party today is they may not have held the spray can to vandalise my office with sexist slurs. They may not have held the camera pointed at me by the stalker or called me evil in Get-Up's phone calls, but they did create the environment in which hate could flourish. So, I say to the Leader of the Opposition, what will you do about this?
Nicole Flint was the target of a campaign by activist groups Get Up and Extinction Rebellion before the last election, during which her Adelaide office was graffitied with the words skank and prostitute. Responding to her speech, Labor leader Anthony Albanese condemned any abuse she received in the past.
No abuse should happen of any parliamentarian or any staff member, and I condemn any abuse. Nicole Flint was subject to terrible treatment in terms of inappropriate behaviour. I call it out whenever I'm asked to do so, whenever I'm aware of it. I do it consistently, each and every time, regardless of who it's directed at. Nicole Flint was subject to very bad behaviour, and that shouldn't have happened.
Jackie, can I start with you? Was that adequate from Anthony Albanese?
I think it's really important that our political leaders are condemning this kind of behaviour, and it's really important that they're talking about this issue at all. But I think what is extremely clear is that we all need a refresher in what good behaviour looks like, and whether that's at a parliamentary level or on a broader community level, we need to start taking steps that actually engender that kind of good behaviour in our relations with each other. So at a parliamentary level, that looks like having a sit down with staff members and parliamentarians that really goes back to basics. It talks about what sexual assault looks like, what consent sounds like or doesn't sound like. It's about making sure people know where they can complain, what they can say if they witness something or experience something in the moment, but also we need ways to apologise and to make space for people who have the courage to apologise. And I think that's an important step in this process.
Neela, this is an interesting one because the most frightening aspect of this was a stalker. And it's not clear at this point this evening how the unions, the Labor Party, the Greens, or indeed Get Up were connected to this stalker. There's no clear connection between the stalker and any of those organisations. Even though the Prime Minister has said that Labor and the unions and Get Up, in a sense, let that happen, they were aware.
Look, I think it's very difficult. What I hope more than anything is that this really important issue around how women are treated in the corridors of power and really in every workplace in this country doesn't become a partisan issue. I think that we should accept that every political party and most workplaces have issues around misogyny, sexism and violence towards women, because that's what we see in society on a day-to-day basis. So it should not come as any surprise that this happens elsewhere. I think that the treatment that Nicole Flint was subjected to was clearly horrendous and unacceptable, and one of the many reasons why women hesitate about entering politics and entering positions of power. But I think that the solution to that is not a partisan issue. It's not to say that this happened because there was an opposition party. I think the solution is to really look at our culture and our society and the way in which politics is conducted. And as Jackie said, actually think about how we engage with each other on a day-to-day basis and what respectful communication looks like. And to that, I would say that perhaps in Parliament, turning your back on speakers, you know, at the very fundamental level is something that probably needs to change.
In question time, I mean, I was struck looking at question time today. Mal, maybe I can go to you. And genuine questions are being asked by the vaccine rollout, about the vaccine rollout by Her Majesty's loyal opposition, the Labor Party, and the Premier's reaction was that this was sort of un-Australian and it was undermining confidence in the vaccine rollout. Now, that's kind of political strategy 101. That's not unique to the coalition. You know, we've all seen the Labor Party do it when in government as well. But I would have thought stress testing the government of the day on how they're doing on something like that's pretty important. And I wonder whether or not that sets the tone, that kind of outrage and dismissive rather than, thank you, I'm a servant leader and I'll answer your question.
Well, I mean, the purpose of question time obviously was to ask questions of substance, but it's now dominated by Dorothy Dix's, by a government who doesn't want to answer, and I mean, it's a waste of time. In the real world where most of us live, it's a bloody embarrassment, a huge embarrassment. And any of the politicians that participate in it should be embarrassed by what goes on. I mean, if my grandkids carried on like that, I'd kick them all in the bum. But the question that you're raising is, and I think that Neela just touched on it. I think the big problem is the culture in Parliament House is wrong, and rather than tippy-toeing around the edges of, you know, little bits and pieces of issues. What about if we try and address what the problem is with the culture? The culture is that the king is winning an election and everything else gets trampled in the process. We will do nothing that will allow us to get a negative mark against us to win the election. And Miss Higgins put it beautifully. She said she was working amongst all her peers. They were all friends. Everyone was all working together. And then after the rape, she was totally shunned. So that horrific act happened, and then all of a sudden she's a political problem. I mean, there is a major problem. And I mean, it ain't easy to fix. I think you've got a problem with the types of people that are going into politics. And I mean, this is a generalisation because I know there are some really good people in politics, but you've got an awful lot of people that have no life experience, have had all their experiences being playing political minder. You know, they've lived the Machiavellian rubbish that goes on. I mean, I've been down in Parliament House quite a bit, and I know the Machiavellian rubbish that goes on, and it serves no one any purpose. I mean, somehow the parties need to start putting some quality people, some people that have got a bit of experience, so when they run into a problem, they can reach down in the bucket of experience and pull out some of that, rather than pull out more Machiavellian rubbish.
Yeah. Pat, can I just go to you just on this issue of how do you campaign? Now, you'd know something about that after many, many decades of campaigning for Indigenous rights and self-determination. I hadn't heard of bird dogging before today, and this is what it is. So Get Up might put out an information sheet about how to find your target, right? They might be campaigning against Nicole Flint. in Boothby against Tony Abbott in his Sydney seat. Find out where they go and have their cup of coffee in the morning. Find out their maybe John Howard-style exercise campaign that they get out every morning in a tracksuit and off they go, and you can find them. And then you can bail them up respectfully, they urge, polite and respectful, and get your point across. Do you think there's a risk with those sorts of tactics, as Nicole is saying, that creates an environment in which this sort of sexism and vandalism and aggression can flourish?
I do. It's not the way that I would operate, nor encourage our people to do that. I mean, it doesn't win you any brownie points. It's quite often very confronting for the person that you're wanting to engage with to do it in that way, and I think it's highly disrespectful. I know that there are occasions when people get angry and want to get a point across, but I don't think having campaigns in that way are helpful. Maybe it's that I'm too old, and we were brought up to treat everybody with respect and courtesy, and we had to treat other people the way we wanted to be treated. And I think that people are losing sight of that. But I want to make a point about the culture in Parliament House, and I think that we're now at a tipping point. But, the Australian people elected these politicians to govern, not to play their silly, nonsensical political games and point scoring with an eye to the next election. We elected our politicians to govern this country, for the opposition to be a real opposition, and for the government to govern in everybody's interests.
And I think it's also important to recognise that these tactics really aren't that effective. I mean, Nicole Flint and Peter Dutton, I think, also had his seat targeted by these groups. They actually were returned to Parliament with a greater majority. So these tactics that are used in terms of bird dogging and harassment and intimidation aren't actually seen as very valuable by the public.
And just a last one on this, Neela. The call that Senator Wong and Tanya Plibersek should have said something. What are your thoughts on that? I mean, on the one hand, they were very senior women, and they had positions that were relevant in the leadership. But at the same time, you sort of wonder, well, are we suggesting that women have a greater obligation than men to sort of, be more nurturing or something, or take a greater, be more moral or something?
Look, one of my least liked phrases is this idea that there is this special place in hell for women who don't support other women. And I think that the reason I really dislike it is because, as you say, it does place that greater burden upon women to always rise above things, always be the ones that are absolutely perfect at noticing problems and fixing them. And really what that does is it disincentivizes and takes that responsibility away from men. Fixing these issues, fixing society isn't a woman's problem. It isn't women's work. There are men out there who can do that. And I think it is appropriate for Nicole Flint to say that people within Parliament should have stood up for her, but to specifically put that responsibility upon female parliamentarians, I think is problematic. And that should be directed more broadly at everyone. It's everyone's responsibility to fix this.
What's key is how this issue and the issue of gender inequality is perceived in Canberra. Is it just another political tightrope to traverse, or a wider cultural problem that desperately needs addressing? Phil Curry is a very well-briefed senior political correspondent. Here he is on Radio National this morning.
Initially, I think the view was that this anger would be confined to tertiary educated women. It wouldn't jump the fence into the sort of quiet Australians in the suburbs. I think it has jumped the fence, and the government became aware of that last week, and they were sort of saying we're going to get belted in Newspoll. So they're conscious of it. It's got away from them, and how you reined it in. I think we're seeing, them trying to do that, but it's not something that they're saying is going to go away.
So there are a couple of things that caught my ear, Jackie. The notion that this was an elite group of people, perhaps these tens of thousands of women all around the country, and that their thoughts had jumped the fence like a bushfire to other women who strangely had similar views on gender inequality and violence and domestic violence and so forth, and that the government's political challenge was not to, well, one of the political challenges that he pointed out there was that they had to rein it in, pull on the reins.
If that was said, they're pretty unfortunate choice of words, and I think the idea that there's a fence between women who care about these kind of issues is completely wrong, basically, and we see that with the marches that happened in Canberra and of course around the country. And the idea that this is a communications issue only is a misunderstanding of how women and men feel about the injustices that are happening in workplaces across Australia. It's clearly not something that is only happening in Parliament. And I think this is the opportunity to show where Parliament can be a leader in this space and actually make those recommendations that can be implemented in other workplaces around the country.
Pat,
Yeah,
what did you think
agree.
of those? Yeah, you tell me.
I absolutely agree. I mean, and they've got to take the lead on this. They've been caught out, and they now have to take the lead. So yes, we've got the examination of the culture by the Sex Discrimination Commissioner. There are still calls for an independent inquiry in relation to the Attorney General being fit to hold that office. You know, I'm not dealing with his other stuff, and I know he's got a civil case on defamation and so on. But, you know, these issues have to be dealt with. That's what the Australian people want. That's what we have a right to expect, that this is dealt with properly. And if you don't start in the national parliament, it's not going to happen elsewhere. And in terms of the rights and the needs of women across this country, not every woman sees equality through the same lens. You know, they see it through their own cultural experiences and beliefs, etc. So we've got to make sure that all the voices are heard in this. We've got plenty to share from First Nations women across the country. And June Oscar, the Social Justice Commissioner, released a very important report on Aboriginal women and girls at the end of last year, which contains some very important recommendations that must be implemented as a part of this whole exercise as well, in my opinion.
And good to revisit those when we go through it all, to go through that Respect at Work document that talked about publishing in the public service, the gender pay gap, a whole range of legislative changes to put obligations on employers and so forth, but also centre that, have another look at June Oscar's report, because I remember we did cover it, to look at the impact on women and girls and the sorts of things that Indigenous organisations can lead and know will make a difference in that space.
Yes.
And that's the thing that seems extraordinary, doesn't it? There's so many bits of paper sitting on my desk that have all the answers on them, Pat. You know. If you've been affected by anything we've been discussing, call Lifeline on 13 11 14 or 1800 RESPECT, 1800 737 732. Now, whether it's a tree change or a sea change, Australians are continuing to flee the cities, we're told. Australian Bureau of Statistics data shows Australia's capitals had a net loss of more than 11,000 people in the September quarter. You wouldn't know it from the traffic. And the government appears eager to promote this mobility, giving the Regional Australia Institute $4.6 million to help fill job vacancies.
You haven't then got to fight the traffic and look at the brake lights all the way home. You're right there where you want to be, spending quality time in your own home, in your own business, in regional Australia. I always say that regional communities are big enough in which to get a good cup of coffee, and they're small enough to still care. And that is the case wherever you go, right across Australia.
Michael McCormack was speaking ahead of a national Growing Regional Australia Summit in Canberra today. But some communities are warning they are already full and skyrocketing prices are increasing housing stress for low-income earners. Outside of the cities, New South Wales house prices have surged by nearly 9% in the last year. Towns like Parkes and Kiama saw prices rise by 24% and 20% respectively. But it was Byron Bay that saw the biggest rise, with the median cost of a home rising by 26% to $1.15 million. Now, Mal, you're the chair of the Regional Australia Institute. I'm probably imagining you've given the government a bit of a nudge on this, on the basis that you've identified, or the Institute has, 54,000 job vacancies in regional Australia. Is this going to be as popular a policy, say, in the regions as it might well be in the cities?
I'm pretty sure it will be. What it's about, Ellen, is making sure that people that live in cities, particularly Melbourne, Sydney and Brisbane, are informed about what sort of opportunities are there. You can have a vague sort of notion that you think it might be good to go out into a region, but you really need to understand it, and people won't move unless they do understand it. And that's part of what this program that we're doing. We've set up a website that people can go to. They can answer a question and then through a series of processes identify something that will appeal to them, to help them make the decision if they're thinking about going to the regions. Don't forget, a third of Australians already live in the regions, so we're talking to the other 66%, or roughly what it is. And keep in mind that Australia is the most urbanised country in the world, so it's good for us to try and get people out into the regions a bit. But people need factual information. People won't move unless they have. Our research has thrown up that there are a group that are there's three groups that are the most likely ones that's come up in our survey work. There's the younger families, 35 to 49, the downsizers in their late 50s, and the blue-collar workers in outer suburbs. So there are some groups we've identified in research that are showing that they are more interested in it. And I guess, you'd live the world about where the problems are. People are worried about avoiding traffic, the stress factors. And COVID's brought that home in spades. I think we've all sit back now and say, gee, is this what it's all about? We need a bit of quality of life. Well, if people go on this website, they might find that regional Australia may be able to assist in some of the things that they're looking for, in having more time to be able to live with, spend with their families.
Pat, can I turn to you? You run a major health service with community clinics right across the regions, remote areas, urban areas. What are your thoughts about encouraging? You'd want the workforce, you'd want the invigoration. Are there any issues on the downside you can see?
Well, my worry is housing stock, and for Aboriginal and Torres Strait Islander people in regional areas, it's not so crash hot, and the investment by governments has been pretty poor, and that includes social housing programs, or programs where people can rent to buy, are scarce as hen's teeth. And so I'm very worried about that. And, this has been a major issue, because housing, safe and appropriately sized housing for families, is very important to maintain the health of a family. If you live in an overcrowded, rundown, poor health hardware in the house, you're going to have serious problems. So, I'd like to see all of those things get fixed. And I'd also like to understand issues about the ongoing water supply and the ongoing, energy supplies in terms of those things. So I think that, I love the country. I was born in Central Australia and raised and so on. But, it's a different story. There might be 54,000 jobs, but how many houses are available for people to move into? And the blue-collar workers on the outer edges of the cities, they'll certainly need to have, better housing available. Not everyone can afford to buy their own house.
Yeah. Mal?
Can I just back up exactly what Pat's talking about? And I agree very, very strongly with what she's talking about. One of the things that I struck when we first started the Institute 10 years ago is that it was really difficult to get the federal government to engage us.
Yeah.
They used to always engage rural Australia as, a few hick farmers out in the bush. That was why we started to talk about regional and started to talk about 35% of the population. So as we now get governments here, and I think it's really, really important to make sure we fix the social housing stock. It is appalling, but we can do that from a strength, and we can work very closely with Indigenous groups to try and make that happen. The more powerful that regional Australia gets, the more influential we are at affecting government policy.
Yeah. Just let me ask you one quick question, and then I want to go to the others on the panel. Mal, do you want tree changes, or are you trying to build a remote workforce, the people who might have a job that's based in a capital city, but they can do that from home, they can work remotely? What are you aiming for? That's the trouble with city people, Ellen. You go down to too granular an impact. I take a good old farmer attitude. I want people. I don't care much what they are. People. Okay.
They can be anything they like.
Okay. Neela, let me put this to you. McCormack was speaking at the Regional Australia Institute, Mal's Institute, the conference, Regions Rising is the hashtag. And there was a bloke speaking called John O'Dwyn, who's an advocate for decentralisation in the United States. And he helped write a law for Vermont's remote worker law. And in Vermont, they said, we'll give you 10 grand if you relocate to Vermont, but only if you're a full-time employee of a business based outside of Vermont who can work remotely in Vermont, right? So they wanted people who weren't sort of, inverted commas, taking jobs, but they were bringing cash into that economy. So COVID doesn't have to be a flash in the pan. There's all sorts of climate change things that underpin that as well. Could that apply here?
Oh, look, I think it could. I think that, we have these mega cities, but, when they're not populous in the sense of global mega cities, they're just huge. Today, for example, one of my good friends who lives 5 kilometres from me, we work 120 kilometres from each other because we work on different bits of Melbourne. And so that's ridiculous. So I think that the idea of decentralising our cities and actually moving people into regional areas so that we have these hubs like they do in the US is a great idea. But as the other panellists have said, you can't just send people there and assume that services will follow. You've got to actually set up those services to ensure that when people get there, they have what they need. Healthcare is a big thing. We're closing maternity wards all over the country. We're downgrading services in health and education and all sorts of things. So I think that just standing up and saying, people don't go to the country because the coffee's no good, but now the coffee's good, that's not going to sell it to people. People want to know that once they get there, they're going to have community, they're going to have healthcare, they're going to have education, they're going to have a place where they can, they have all the things they need to raise their family. And that's going to include workers working remotely as well, because they might be able to work remotely, but their kids have to go to school and they've got to be able to see the GP where they live.
Jackie, can I come to you? We played a game. I'll just go to Jackie quickly, Mel. Played a game in the office, and the drum may not be on tomorrow night, actually, because we asked the question, if you could live anywhere and still have a meaningful job or career, where would you choose to live? And hint, spoiler, the answer wasn't Sydney. But what's your answer?
I mean, that's a shame for me. I'm about as urban as it gets. I ran for the seat of Sydney, so it's definitely a place that I love dearly. But my family have had a hobby farm in generations, and I think this is actually a really good opportunity for states and territories to look at how they can be providing those services that have been talked about and actually drive that movement to different regional areas on a state.
But no one's getting you. No, you're not throwing everything in the back of the ute.
Personally, it's probably not for me just yet, at least. But I do know people, friends of mine, who have moved out of cities during COVID, and of course, the regional areas were hardest hit during COVID, but also with the drought. So having that investment will be really vital to ensure that they are vibrant communities in the future as well.
You're watching the drum, and with me on the... sorry, Pat, you go. I can do that
Well,
later.
the other thing is, that the NBN and the internet connection is absolutely vital if you've got to work remotely. And that's not necessarily right up to scratch across regional Australia either. So I think that, the Commonwealth has got a responsibility. I mean, I've said before that it's walked away from Aboriginal housing. I'm very unhappy about it, and they need to come back and put a proper plan in place with us and with the states and territories to get Aboriginal housing sorted out. And they just can't walk away from it and say, well, it's the state's responsibility, because the states haven't necessarily all agreed to that either.
Yeah. Final word, Mal?
Well, I was going to give you an example. The young lady who operates as our public relations officer lives in Warrialda, which is sort of out the back and beyond. It's 800 k's from Sydney, 300 k's from Tamworth, and she operates out, has been for 5 or 6 years, I suppose now, and does it 100% successfully. I mean, I'm on Skype at the moment with you from 800 k's away, and I do a heap of Zoom and Skype stuff, and I can operate, as though I was in the middle of Sydney.
And then happily you're not. Happily for you.
You can say that again.
Sadly we are. You are watching The Drum, and with me on the panel, Senior Accounts Manager for communications firm Agenda C, Urban Vice President of the New South Wales Liberals Council, Jackie Munro. In Wollongrar, farmer and former President of the New South Wales Farmers Association, Mal Peters. In Melbourne, plastic surgeon, Dr Neela Janaka-Ramakan. And in Canberra tonight, CEO of the National Aboriginal Community Controlled Health Organisation and lead convener of the Coalition of the Peaks on Closing the Gap, Pat Turner. The government is sounding the alarm over the COVID outbreak in Papua New Guinea. Earlier this week, Queensland health authorities who've been assisting with testing support recorded 250 positive coronavirus results out of 500 tests done in PNG. And with some Torres Strait Islands within sight of the PNG mainland, there is now a real and present threat to Australian communities. The Drum's Eliza Harvey has more.
Papua New Guinea is grieving the death of its first Prime Minister, Sir Michael Somare. And the coronavirus is bringing more pain for its people.
We are possibly having an infection rate of about 1 person to 3 or 4 in our country.
Papua New Guinea's rugged landscape and developing economy, which won't survive a total lockdown, make this crisis particularly hard to manage.
In the simulation that we've done, the number is quite staggering, and if we don't do proactive response to this, our health system will be clogged.
Papua New Guineans are being asked to stop any unnecessary movement, but it desperately needs vaccines and PPE. And today, the Australian government committed to that vital medical equipment, including face masks, testing kits and 200 ventilators.
Our government will also be moving immediately to gift 8,000 doses of our COVID-19 vaccine stocks from our domestic stocks to support the vaccination of frontline health workers in PNG from next week.
Flights from Port Moresby to Cairns will stop for a fortnight. Freight will continue. Australians won't be allowed to travel to PNG unless they're emergency medical and aid workers. The federal government's package has been roundly welcomed.
This will enable our health services to get on top of the issues, because as we do know, The number of positive cases in our hospitals at the moment of COVID, over 50% are from Papua New Guinea.
An uncontrolled pandemic is how variants of concern come to light, and that would be not only a major problem for PNG but also for us and the region.
Papua New Guinea's chronic tuberculosis epidemic will make the COVID challenge harder.
PNG has a severely under-functioning health system, and that's particularly bad outside of Port Moresby when you're up in the provinces. Port Moresby General Hospital is at capacity. 2 of the senior doctors in the hospital have been calling for additional resources for months. This crisis didn't happen overnight. This has been slowly escalating for at least several months now.
Jack O'Shea left remote PNG on Monday.
There's myth and stigma about the vaccines. Is this an overseas control mechanism? And we're dealing with people who are very susceptible to that stigma.
The country's health crisis has big implications for its nearby neighbours in the Torres Strait. The vaccine is being rolled out there, but overcrowding remains a big issue.
We've got just over 400 people live on the island. To put in perspective for your crowding situation, there's only just over 80 dwellings or houses on the island.
An emergency Australian medical and humanitarian team is due to arrive in PNG early next week.
Pat, can I ask you for your reflections on this? You run health clinics right up in Bamaga and, as I said earlier, all the way across the country. What's your level of concern here?
Well, Queensland Health is right on top of this, yes. And they're responsible for the COVID AstraZeneca rollout in the Torres Strait and in the Cape. There's very strong cultural ties, of course, between the Torres Strait Islanders and the people from Papua New Guinea. They just row across on their canoes.
Yeah, I hadn't realised. I looked up where Thursday Island was today, and I hadn't realised that Saibai is right up, tucked in. It's a couple of kilometres from the most southern province there.
That's right. So with Saibai, there's always been an interaction between people from PNG and the Torres Strait Islanders. But I think that our people are very much aware in the Torres Strait about the dangers of COVID, and they'll be taking every precaution, as will the information. So I've got every confidence that Queensland Health will, be able to manage this and control the movement of people with the cooperation of the Torres Strait Islander leadership.
Yeah. Well, here in Australia, GPs say they are being inundated with requests from people trying to book their vaccinations ahead of the Phase 1B rollout next week.
Yeah.
The government has created an online directory of clinics offering the vaccine and in many instances the option of making a booking. However, users have reported errors when attempting to click through to that function. The Health Minister says logistics will be finalised in the coming days.
Today's the first day, and the vaccines are actually being rolled out to the individual practices over the next 48 hours for commencement next week at a time that fits with them. Secondly, in relation to that, the answer is that the practices themselves will determine which patients they are able to serve. That's just a minor correction to that which was published today, that it's up to the individual practices. Some of the practices have said they will take all comers. The GP vaccination clinics, which have been doing the testing, what are known as respiratory clinics, but will now be vaccination clinics, they will take everybody.
Phase 1B covers more than 6 million Australians, including people aged over 70, Aboriginal and Torres Strait Islanders aged over 55 and adults with underlying medical conditions. But it's now clear that the government will miss its target to have 4 million people vaccinated by April. So far, nearly 204,000 people have received at least one dose of the vaccine, which is around the number we will need to be inoculating every day to meet the government's targets. Stephen Duckett is the Health Program Director at the Grattan Institute and he joins us now. Stephen, let's try and understand this. We're about to roll out to the second group. So 1A was the priority group and that was included lots of frontline people in quarantine and also people in aged care residents in disability group settings and so forth. And then we come to Group 1B. Why are we starting to vaccinate 1B when we haven't finished 1A?
So the states essentially have been responsible for vaccinating their own staff, the frontline healthcare workers and the quarantine workers, and they've essentially been doing that with the Pfizer vaccine. The Pfizer vaccine requires special storage requirements. You have to store it at -70. And general practice basically just doesn't have that, and you can't expect them to have it. The Commonwealth has been responsible for using the Pfizer vaccine for the aged care staff, and so that's what Phase 1A has been. And also prominent politicians obviously somehow snuck into that list.
Okay, but there's 2,717 aged care facilities in this country and about 500 have been vaccinated. Why is that?
I think the Commonwealth wasn't aware or didn't contemplate the size of the logistic exercise. They contracted it out to private firms and they basically haven't done it quick enough.
Okay, so, I mean, it's been coming for a while. The crockery's been rattling for about 12 months now on this. What is the difficulty? I mean, does the Commonwealth have any experience of doing this, the on-ground delivery mechanism and so forth?
Basically not. So the Commonwealth has put its eggs in a GP basket and a pharmacy basket. And I think it's actually great that GPs are able to vaccinate their own patients. I think it's great that we have a disseminated strategy of that kind. But the reality is you're not going to get mass vaccination unless you have mass clinics. If you go to your GP, they're not going to be able to have 50 people sitting around the waiting room because the waiting rooms are just not big enough. And so you've got to observe the people after they're vaccinated. So the GP strategy is an access strategy, but it is not going to solve the problem. If you're going to have 1 million people vaccinated a week, which is what we need to do, you're going to have mass clinics, you're going to have take over town halls and so on, which means you're going to need feet on the ground, you're going to need people to negotiate where's the best place to do it and so on. And the Commonwealth just doesn't do that. Okay, and so
you listened to that press conference as I did today. Was there anything in that gave you the confidence that the Commonwealth is contemplating that sort of thing? Once you get through the vulnerable population, you're picking off individual people in vulnerable populations to get a mass rollout like that. Let's get the MCG, you know?
Yeah, so basically the Commonwealth hasn't met any of the deadlines it set itself for the vaccine rollout. And even the schmozzle today with the booking system. Is it a booking system? Is it a place where you ring up someone? Can you do it online? And does it collapse anyway? So, you know, to be fair, it hasn't gone very well at all. The problem also is that they're starting to negotiate with the states about mass vaccination, but at the moment they're paying GPs $35, I think, for the first jab. And they're saying to the states, we want you to do it for $13.50 or something like that. And so, you know, if they're serious about getting this vaccine rollout right, you've got to actually say, we are serious, we're going to pay states the same as GPs and say to the states, here, we'll give you 1 million doses, make sure they're all done in the next month. And, you know, be really clear on the targets and really clear to the states that you've got to do this and do it quickly because there is a real cost of the slow vaccination. The real cost is not today and tomorrow because the vaccine is basically not circulating in Australia, The real cost is the border opening.
Not the vaccine's not circulating, the virus isn't circulating.
Sorry, the virus is not
therefore
circulating.
Therefore you've got the economic cost of continuing to be locked
Well,
down
the
as a
vaccine's
continent.
not circulating either.
Yes,
is the
right.
reality.
Yes, good point.
But because the virus is not circulating, it's not a serious problem. The serious problem is we can't open the borders until we've got a significant proportion of the population vaccinated, and the more we delay that, the more there are consequences for universities, tourism and everything else.
And Neela, if I can go to you, I mean, Australia had been expecting 3.8 million doses of AstraZeneca vaccine from Europe, only 700,000 arrived, but there are many more doses of this vaccination than are going into people's arms, I think by a factor of about 10. So the issue isn't exactly supply. What's the issue from your point of view?
I think, look, I've been talking to a lot of my GP colleagues about some of the challenges of actually administering it. And it is, it's a great strategy. GPs are great at giving vaccinations. Every year we give 15 million flu vaccinations through GP clinics, pharmacies, and a variety of other means.
But this is a lot more than 15 million, right?
It is. So we're probably looking at 52 million if you think that every Australian needs to have 2 doses. So it's a huge upscale of that. And so, for example, I spoke to one of my GP colleagues today. They've gotten their 80 doses for the week. That's their allocation, and they need to administer that this week. That will take a GP out of normal practice. That will mean that the backlog of health conditions that are still presenting to GP practices because people didn't attend last year, there will be delays in that care. So there's lots of logistical complexity. So it's not just about money. It's not just about having a nurse there to administer it. It's about the space in the waiting room, the space to recover, the number of appointments that are available. And it's also very difficult for practices. Hundreds of practices have had thousands of phone calls today from people who want to book in, and yet some practices like this one has their 80 doses. Some practices don't know when they're going to get it. And then how do you prioritise these people? You get 400 phone calls and you've got 80 doses this week and then 80 doses next week and then 80 doses the week after, and then somewhere in the middle someone who falls into a high priority category calls up. So I have enormous sympathy for practices and practice secretaries at the moment.
Mal, can you get it in your area? What have you learned today?
I rang my doctor up, who's one of the practices that has been identified in Inverell, which is about 80 k's away. They said we don't have it. They expect to get it next week. The local member was on the radio telling people to ring them. So they've been, as Neela just said, they've been inundated with calls, but they don't know. I think they were talking about getting 50 doses. So you've got 2 practices. You've got 16,000 people in Inverell, 2 towns close by being Glen Innes and Tenterfield. They're not going to be given anything. So, I mean, I don't want to be critical because they're just starting, but I can see a bit of a road smash, particularly when you think about Commonwealth government delivering any services on the road. They are notoriously bloody hopeless at it.
Jackie, the Prime Minister was saying early on that everybody would be vaccinated by October, and then that language seemed to change to, well, everybody would have at least one by October. What's your thoughts on the community perception of how this is going?
I think it's really important to have a goal in this, because for a year during COVID, we have been trying to work together as a community to keep each other safe. And I think this is a communications exercise, absolutely. So far, we've had people who've been vaccinated through their institutions. So it's been very well managed in terms of having doctors, medical staff, and aged care professionals.
Now, as I say, that 1A is not nearly done, from what I understand.
I think the next stage will be very interesting because it actually requires people, individuals, to actively go out and make that appointment with their doctors. So
surely that's not the problem.
Well, I think it will be a measure of how much people trust this process and how much they trust the vaccine and the communications around the rollout. And again, it is about asking people to sort of work together on this so that we can achieve a herd inoculation as quickly as possible. I mean, I called up my grandmother today because she's not going to go online and book anything herself. She's in her 90s. I don't think she's even got a computer. So it's really important.
Did you get her an appointment?
I wasn't able to today, so it's something that I still have to follow up with her. But I think it's really important to recognise that people will need assistance in this process, and my grandma is lucky to have a loving family, but we need to have those community supports.
Pat, your community-controlled health organisations are delivering this vaccine. How's it going, or will be?
Well, it will be, yes. 107 of our Aboriginal medical services around Australia out of 143 have signed up to give the vaccine in their communities. That is a very high level of engagement. There's a lot of preparation that each location has to do, including communications, very clear communications with our community representatives in the across the regions in the service area, and to make sure that people really understand about the vaccine and the importance of just not having the vaccine for your own well-being, but for the well-being of your families, your friends, and other members of your community. So these are important messages, and our health services at the front line will work at the pace of the community. It will not be dictated to otherwise, because if you don't have the community on board and engaged, you're not going to achieve anything. So we're very keen and we're very well prepared, let me tell you.
But the focus on the informed consent, Stephen Duckett, what do you think needs to happen? Do you think the kinks will just iron themselves out?
So if you don't do anything specific, nothing specific is going to happen. So the government has to say, we recognise we haven't done so well in this so far. We've got lots of vaccines here and we haven't put them in people's arms. So the vaccine is, it doesn't do anything if it's sitting in a shed. So the government has to say, we recognise that we've got a long way to go. We've got to lift our game. We're not going to achieve our March target. But this is what we're going to do. We're going to do these three things. And one of those first things is to engage the states and say, we are sorry, we now want you to be up there. We want to keep going with the GPs, we want to keep going with the pharmacists, but we also, so we need to change our basic strategy. We need to iron out the problems of the booking system and so on, and not oversell, not say to everybody, ring up your GP today. The poor old GPs only have, 80 doses, and they don't want to have 800 people ringing them to say, it's just being reasonable, being clear, getting your communication right, as Pat says, getting the community on side, and be systematic about doing it, and rather than being all political and hype and marketing, get on the ground and get doing it.
Yeah, we're out of time, Steve, but just let me say, so the key difference in all of that, as well as the sort of best practice with informed consent that Pat's talking about, easing up on the GPs and getting the supply going out, is to engage state governments to do what? Mass vaccinations at large.
If you want to do 1 million a week, you've got to have big places to do it.
OK, hire some halls. OK, Stephen, thank you very much for your time.
Alan.
Stephen Duckett is the Health Program Director with the Grattan Institute. My eye was drawn to this article in the Washington Post, written by the ABC's Richard Glover recently, explaining Australia's success managing COVID to an American audience still ravaged by the virus. Before he gets to useful tips like follow the rules and trust the health system, Richard highlights the success Indigenous Australians have had keeping COVID out of their communities, and he cites public health expert Fiona Stanley, who says Australia has recorded the best result for any Indigenous population in the world. I don't want to embarrass you, Pat, but you've been central to that. At the heart, Richard writes, of the campaign was a First Nations passion for protecting elders. He quotes you in the Washington Post, they are our universities, you've said, the holders of our knowledge. And he quotes you, Pat Turner said there. I just wonder, is it a moment to reflect as you begin the next section on how that's gone and what that means now for the partnership agreement, now 2 years old, that historic agreement where the Coalition of the Peaks sat down with all the governments and said, come on, let's do this in partnership, not to Aboriginal people, but directed by Aboriginal people.
That's right, on closing the gap.
That's it.
And let me remind the viewers and the panel that tomorrow is Closing the Gap Day across Australia. So there'll be lots of activities associated with that. The partnership, we're going from strength to strength in the partnership. So the agreement was signed by the Prime Minister, the Premiers and the Chief Ministers and the President of the Local Government Association and myself on behalf of the Coalition of Peaks. This is a very unique agreement and we're nearing 2 years next week, the anniversary of the partnership agreement and of course the national agreement. The first anniversary will be in July this year. But the strength has been in the formation of the partnerships at the state and territory level, so strengthening those and really sort of and creating those in many cases for the first time, where Aboriginal community-controlled leaders of service delivery organisations and policy influencers are sitting at the table with the government officials at those levels, working things out, and in particular right now, development of their implementation plans for all the actions required under the agreements. And the implementation plans will feature the 4 priority reforms, which are the structural changes that will drive the whole and reset the relationship between First Nations people in this country and governments across the board. So I'm very pleased with the progress.
About this time last year, you started showing up in the Prime Minister's courtyard at press conferences, Pat, and there was this response that the Washington Post is talking about of you as a representative of Aboriginal leaders saying, we need to use the Biosecurity Act to keep Indigenous people safe. Here's what we need to have, what has been a world-beating response for Indigenous people around the world. And there have been some tragic outcomes, you know, for Indigenous people, particularly in South America.
Absolutely.
Is that what this partnership agreement looks like when you walk out of the room? People like you having those personal connections with senior politicians and bureaucrats?
Yes, it does. And it means maintaining those conversations at the very highest of levels to drive the change home and engaging, of course, with senior public servants and getting all public servants to understand their role in this change. And so my engagement with senior public servants, has been very constructive. And it's hard to change the culture of an organisation, but that's what's got to happen.
Mm. And are you confident that beyond the personalities of yourself, of Scott Morrison, of the Health Minister Greg Hunt, that this sort of architecture that you're putting in place will endure?
Yes. If we get it in place now with the 4 priority reforms, the strengthening of the Aboriginal community-controlled service sector and building that, the transferring of the resources from government-run programs to community control. If the community's at the centre of everything and government goes to them, like, Glyn Davis was saying on the program about his new book last night and the off-ramps and whatever, it's all there in the National Agreement on Closing the Gap. And we've got the architecture being put in place so we don't fall over. We don't fall over. Yeah. We make sure that we've got the structural reforms that will make sure we've got a sustainable, ongoing arrangement. Thanks.
Well, congratulations. It's been a huge piece of work for a lot of people. Thank you so much for telling us about it. And that is all we have time for. Thanks to our panel, to Jackie Munro, Mal Peters, Dr. Neela Janika Ramanan and Pat Turner. Have a great night, and Jules is in tomorrow. Good night to you.